Good evening, Los Angeles. I hope tonight this finds you and your loved ones well. I want to thank you all. It's been a while since we've been able to chat with each other, and I know a lot has gone on in the last week. But I want to reiterate to you that the #1 job of your city government is keeping you safe. In this last week, we saw just how important that is, as we saw wildfires and the dangerous heat wave, fires that threaten communities statewide, all while we continue to fight COVID-19. And on every front, our city is taking action to protect you and to keep you well. Our Department of Water and Power crews worked in extreme heat to make sure that you had power and water, and I want to thank them for the work that they have done. Just 150 customers right now without power. Our dedicated rec and park staff provided relief to Angelinos who didn't have a cool place to go on some of the hottest days of the years at our rec centers and cooling centers. And our Los Angeles Fire Department firefighters, together with their brothers and sisters from across Los Angeles County, and especially the Los Angeles County Fire Department, are putting themselves in harm's way as they do every single day to protect our homes, our communities, and our loved ones. I want to say thank you to every dedicated public servant who is out there today in the most trying times, in the most trying year, who are there trying to protect each one of us. And all of the people across Los Angeles who continue to inspire me and inspire each other by the sacrifices that you make to protect us all from COVID-19. And those steps, big and small, are beginning to pay off. From the start, our top public health goal was to keep infections low enough to ensure that our hospitals had the capacity to treat those most deeply affected by the ravages of COVID-19. This is absolutely critical. In our peaks and valleys, Los Angeles has never run out of hospital beds. Images that we saw overseas or across our country never came here to Los Angeles. And while we've had scary moments where we wondered whether we would teeter over the brink, our talented medical professionals, who I want to thank once again, from the doctors and nurses to the techs, to the folks who are cleaning hospitals and running the cafeterias, who are keeping our people safe as they keep us healing. We've never had more patients than we could take care of. And today, I'm proud to share that our hospitalizations are now down to the lowest level we have seen since April 7th, more than 3 months ago. That's a significant achievement and a fragile one. The county now estimates that the rate of transmission, referred to as the R0, is at 0.92, still under that 1 mark. It's up a little bit from last week, which was just 0.86. But as long as it remains below 1, we should see caseloads continue to fall. Our COVID-19 level remains at orange because it is close to 1, that R0. But if we keep this up, it shows that we can beat this virus back. Remember, when it comes to this data, and I know numbers can be overwhelming, I want to give you a couple simple goals the state has put forward for us. We need fewer than an average of 100 cases per 100,000 people for 14 collective days. What does that mean for a county like Los Angeles? That means less than 10,000 cases over a 2-week period. That's what it takes to get off the state's watch list and to move to the next stages of recovery and reopening. And while we're working to get to that 100 per 10,000 number, schools are permitted under the state to apply for waivers, school districts and individual schools, under state guidelines if we get below 200 cases per 10,000 people. In other words, 20,000 cases over a 14-day period. So let's keep those numbers in mind. Let's push towards those goals for our children, for our economy, for our well-being, and for our health. Right now, we're hovering at about 250 to 300 cases. That's 25,000 to 30,000 cases over a 2-week period. To put that in perspective, thus, we'd have to cut almost in half as many cases we had today just to apply for a waiver for schools, and we'd need to sustain that for 2 weeks and cut as much by 2/3 where we are still today to get off the state watch list and keep that going for 2 weeks. Now, these goals might seem tough to reach, but I believe in you. I've seen you. I know what you can do, and I believe we collectively can get to those goals. Today, 5 of the critical indicators that we track are headed in the right direction. Our hospital inventory remains stable, and across the county we have 695 available beds, 560 of them for acute care, and 135 ICU beds, as well as 1,108 available ventilators. Those are all strong numbers. But we have 420 ICU patients who are severely sick, and our hearts go out to the families that every day are praying for their recoveries. But that 420 is a substantial decrease since last month. So no number is a good number, but it's a better number than we've seen. This progress has been made possible by you, and it's only sustainable if you keep doing those things you have been doing, washing surfaces in your hands, keeping your distance, staying home, and wearing your masks. But this is not a time to let up. The flu is just around the corner. And when COVID-19 and the flu are here together, our public health system and our hospitals will face additional pressures. So I want to encourage everybody to start making plans for you and your family, your fellow workers and loved ones to get annual flu shots, which become available in mid-September. I was a member of the United States Navy for 12 years, and I got one every single year from the Navy. Now, as a city employee, I make sure everybody in my office gets them too. They work, they're good, and they will help us make sure we don't have the pressure in our hospitals when folks need to have the care from COVID-19 or other debilitating diseases. Let's run through today's numbers. The county recorded 1,759 new infections, bringing the total infected at 229,054 LA County residents. 693 of these cases were here in the City of Angels, bringing our city's total to 92,861 cases since we tracked this in March. This week we saw fewer cases overall, with 10,801 cases compared to 14,863 in the week prior. In other words, last week was almost 40% more cases than this week. It's a great sign. Of the 229,054 cases that we have recorded in Los Angeles County since March, roughly 41,000 of those, big number, but a fraction of the overall, are considered active cases right now. That metric, it matters a lot to us because it tells us that only about 18% of people who have had COVID in LA County have tested positive in the last 21 days. I'm so glad we have this data because everybody always asked me, I know the big number, Mr. Mayor, but how many people have that now? And that estimate is 41,000. It's a very important number because many others who are included in that grand total of 229,054 have recovered. We also know that some, over 5,000 now, have passed away. And we also recognize that many are experiencing long-term symptoms that we're still learning about. And I want to say something to those who have lingering symptoms, who sometimes have gone to doctors and hospitals that say, oh, it's just in your head. I want you to know that we see you, we know what you are going through. People should know that even if the virus does not take your life, increasingly we're seeing folks that are what we call long haulers, and that we're all at risk, even if we don't die from COVID-19, of seeing our lives fundamentally changed, not just for a couple weeks, but for a longer period of time. These long haulers have lingering and devastating symptoms that last weeks and months after they are no longer considered infectious. This is a devastating virus. It does more than just kill people. And even if you're young and healthy and say, hey, it's not going to take my life, it can change your life forever. So let's keep it up. We know the worst part of these press conferences is always the announcement each night of the fallen. 46 new deaths that we heard announced in Los Angeles County, bringing our total now to 5,491 loved ones who are no longer with us. In the city of Los Angeles, that number is 2,414. This week we saw, though, fewer overall deaths, with 291 compared to 310 last week. So here's the bottom line. The data trends tell us that what we're doing is working, and there are signs of light, and boy, do we need that light to keep shining. But I want to be clear that this is also saying that we're not yet out of the woods. We can't relax, we can't let up. COVID-19 is still here, it's still dangerous, and we need to keep doing our part. We need to hold the line. That means continuing to exercise extreme caution, getting tested if you think you might have been exposed, and if you have any doubt at all, ask a doctor for an appointment, schedule a test at a community health center or a city, county, or state site. At city sites this week, we have the capacity to test more than 18,000 people every day. We've seen that demand fall by about 15%, but we're going to keep the capacity there, just in case we ever need it to surge up. And I want to thank the volunteers and the firefighters who are out there in this blistering heat. While you might be waiting in a car with the air conditioning on, they're out there sweating it out to make sure that you can get that test. And as of today, 2.15 million people in Los Angeles County, more than 1 out of 5 people have been tested. And the cumulative rate of persons who are testing positive stands at 9.8%, a small decline from 9.9% last week. Within the city of Los Angeles, through our drive-through and our walk-up testing sites, we've now tested more than 1.2 million times. And the cumulative rate of persons who are testing positive in those city sites stands at 7.2%, down from 10.7% last week. Also good news. And as we continue to scale up our testing, communities across LA are stepping forward to offer partnership and support. I'm grateful in this international city to the Consulate of Mexico, which partnered with the county to establish a testing site on their premises with the capacity to test 1,500 people each week. And the Consulate of Israel, which helped go to Boyle Heights, where both my Mexican and Jewish sides of the family grew up, to set up a site there, which in a historically Jewish and predominantly Latino area. This is what it means to live in Los Angeles, to call this place home, where we don't just embrace diversity, but we know that everybody belongs, and we will help everybody, no matter what language they speak, no matter where they come from, what zip code they live in, the color of their skin, or how they worship God. And as we continue to send mobile teams around Los Angeles, we want to find where that need is immediate, not always waiting for folks to come to us who might not have cars, who might not be able to hear on the nightly news what's happening, whether it's somebody who's unhoused, whether it's somebody living in public housing, whether it's somebody who's in one of the ethnic groups that disproportionately has a higher positivity rate. We are there. This week at North Hills Community Park, at Mar Vista Gardens Housing Development, and on Sunday we will be at Mariachi Plaza and Green Meadows Park as well. Tests are free. If we come to your neighborhood, we'll make sure people know. We often do it with census takers who are going out there, census ambassadors, and don't forget to fill out your census. But we are prioritizing people, as always, who have symptoms, who think they've been exposed, or are essential workers. But anybody can get a test, and for one of the more than 100 testing centers to set up an appointment, please go to coronavirus.lacity.org/testing or call us at 311. And remember, if you get a call from a member of a county contact tracing team, answer it. This is critically important for all of us, not just for your health and the health of people you've been around, but for this entire county's health. And still, you'll get a $20 gift card if you go through the entire interview process. We know it takes a little bit of time, but it's worth it. Not just because you get a reward at the end, but knowing the reward of saving lives every minute you stay on that call. Testing and tracing are two extremely important tools in preventing the spread of this virus. And we're going to keep using every tool we have, wearing a mask, washing our hands, keeping a distance. And as I've said from the beginning of this, if you're thinking about hosting or attending a gathering, cancel those plans. We simply have lost too many parents, too many medical professionals, siblings, friends, essential workers. We know these people. We know their stories. They are our fathers and mothers, our brothers and sisters. In my family, my cousin. We know their stories and we know who they are. And in their memory and for every family that we love in this county so they don't have to go through that, we have to make sure we control this virus. These are the actions that will keep us safe, that stop the virus, that will ensure that the students who started school this week from behind screens can someday return to the classroom. Staying safe from this virus also means keeping people in their homes whenever possible and making sure people don't get kicked out of their homes because they can't pay the rent. And so I'm glad yesterday that Council President Nury Martinez, her colleagues on the City Council on the COVID-19 ad hoc committee recommended allocating $200 million in coronavirus relief funds to provide additional housing and services for unhoused Angelenos, a priority of mine with these coronavirus funds as well. I've said that all of us, this is not just a commitment to housing. It's not just a commitment to health when we're fighting against homelessness. It's a commitment to racial justice, and it's a commitment to shared prosperity in the future. We will not let the coronavirus crisis slow down our response to homelessness. We're going to use this moment to accelerate our response. That's what we did when we froze rent for LA's 624,000 rent-stabilized units and invested $103 million in the largest direct rental assistance program in the country that will next week start paying landlords and meeting the rent of tenants throughout Los Angeles. And while the state legislature and governor are considering a legislative fix to make sure tenant protections, especially eviction proceedings in court, will be in place so that we can make sure that those cases don't move forward, I want to remind LA's residential and commercial tenants the protections that they have in place today, your rights and everybody else's responsibility. Taking care of our most vulnerable isn't only a job for government. We're seeing people step up throughout Los Angeles to help. El Nido Family Centers and the local restaurant All Day Baby, which some of you saw me on national television talking about this week, are delivering hot meals to the residents of the Cedar Grove at Jordan Downs Housing Development in Watts. And if you want to make a difference this week, donate a meal or 2 or 10 or 100 by going to alldaybabyla.com and click on the icon to help donate to families in Watts right now. Keep a restaurant going, the employees going, and help those who are food insecure. And as long as we're safer at home, we'll stay committed to ensuring home is a safe, comfortable, and affordable place for all Angelenos. And so I encourage all local tenants to visit our housing department webpage at hcidla.lacity.org or call us at 866-577-RENT for more information. And for those who are worried that they might be in the proceedings to be evicted from their apartments, I want to remind you of the legal assistance that we, and the county also has a program rolling out, have organized. Here in the city, we call this LA Represents, and it brings together the top law firms in this city to provide free legal assistance for both individuals and small businesses as part of the LA Represents program. You can find out more at coronavirus.lacity.org/LA Represents. Since the earliest days of this crisis, we have made it a priority to protect our city's essential workers, including requiring employers to provide face coverings, places to wash hands, and all necessary PPE to their employees. We've done it by guaranteeing supplemental paid sick leave for workers in Los Angeles that didn't have those protections, and mandating rigorous sanitizing and distancing measures for customers, for visitors, and for workers alike. And in the months since we put that groundbreaking order, the strongest in the nation and one of the first, we've worked with industry leaders, listening to them and to workers to ensure compliance across the private sector. Last week, after hearing that some port trucking companies were not following proper safety protocols, our port's executive director, Gene Soroka, who you've seen on nights like this because he's become the chief logistics officer for our COVID-19 pandemic, helping hospitals get PPE, bringing necessary materials through our port and through other means. He got in touch with those companies and required them to adopt proper public health protocols, including providing all essential workers with adequate PPE. We owe a debt to these essential workers, these truck drivers, these longshore workers, these other essential workers that are stepping up with danger to them on the front line to make sure we get the food we need, the goods that we order, and to keep our economy moving forward every single day. And I want to give a special thanks to Ron Herrera and the Los Angeles County Federation of Labor, who've been feeding families, who've been stepping up, and for your leadership in fighting to ensure the safety of drivers. I hope this message will be heard loud and clear in every sector and every community. If you're doing business in Los Angeles, you must protect your people from COVID-19. Full stop. Too many Angelenos are hurting from the impact of this virus, and we will continue acting to keep everyone in this county, in the city, safe, and support those who are struggling most. Of course, we know some of the hardest hit are our small businesses. That's why, especially for our restaurants, on May 29th, we launched LA Al Fresco, a chance to save restaurants and jobs and to have a great and safe meal outside in our beautiful weather. It helped mom and pop restaurants safely serve customers outdoors, and it offered a streamlined, no-fee temporary permit for outdoor dining on sidewalks and private parking lots, even in parking spaces on the streets. Since this program began, 1,486 businesses have received these no-cost permits to operate safely outdoors, helping to keep their doors open and their workers on a payroll. For so many of these businesses, it has been a critical lifeline. Escala, a fusion Colombian Korean restaurant, only in LA, of course, in Koreatown, was able to bring back 25 of its nearly 30 employees by extending service into their parking lot in Koreatown. I've been there, it's a great restaurant. And now they're doing nearly as much business today as they were doing prior to the pandemic. Another place my wife and I used to love going to, Casita del Campo, Mexican eatery in Silver Lake, brought back 100% of its employees after phase 1 of Al Fresco allowed the restaurant to expand into their parking lot. As with every component of our response to this crisis, we've kept equity, though, at the center of this initiative, installing 20 curbside dining areas in neighborhoods that were disproportionately impacted by job loss, or at businesses owned by Black Angelenos or Angelenos of color. I'm committed to making sure these businesses continue to lead the way towards recovery, to make sure that we can make them provide us with the food we want and the jobs that we need. So tonight I can announce that we are extending all LA Al Fresco permits for outdoor dining on sidewalks, private property, and parklets throughout the end of this calendar year. It's good news for our restaurants, great news for Angelenos. And this expansion prioritizes the health and safety of patrons and employees, and businesses still must adhere to state and county and city guidelines. Businesses with LA Al Fresco permits can download their permits, their new ones, starting tonight. Be sure to print them out and post them at your business. And if you have not applied yet, go to the same website for renewals or new permits, coronavirus.lacity.org/alfresco. I know that this remains a difficult, a stressful, a painful, and a sad moment. But it's also a hopeful, a strong, and a resilient moment where our work continues, our work for racial justice, our work for economic recovery, our work for our health and our lives. And I am so proud to be the mayor of this city of angels, where angels throughout this city are spreading their wings out to protect those who are unhoused, protect those who need a meal, to reach out to those who are worried about their housing, to look at what we can do to thank our essential workers, whether they're in a grocery store or a warehouse or at a hospital that we visit. This is LA Love. This is who we are. And this is how we will get through this darkness. There is light coming. Every day we're working hard with medical professionals and public health officials to get even better with testing, to look at therapeutics, to watch the vaccines and to prepare for them. And we'll be announcing more of those in the coming weeks as we work together closely with the county and the state to make sure the first moment that vaccines are here that we can distribute them, to make sure that we're getting into streets and blocks and communities that have been overlooked for too long and where COVID-19 preys. We must see this moment, not just as a moment to protect ourselves, but to do better, to be more, and to look at the future, not just as a return to normal, but a reimagination of who we are and what we can do. In our city, we lead with that innovation, we lead with that creativity, we lead with that passion and commitment, and yes, we lead with love. So thank you for all that you are doing. I wish you a very good weekend, and as always, wishing you strength and love. And with that, I'll be happy to answer some questions. Thank you. First question.
And that comes from Claudia Bashuda from KNX News Radio. Please go ahead.
Hey, Claudia. Much love to you.
Hi there. I have a few questions as usual. Some of them are smaller.
Sure.
So first of all, I'm wondering if the city is playing any role in LA Unified testing program. And the second topic is about the emergency shelters at the rec centers. What's the total number of shelters that are still open? How many beds are available and how many are occupied? And if you can talk about why so many have been closed,
Sure.
And do you think it was a good idea to start closing them when there are still so many people on the streets? COVID remains a big threat, and extreme heat warnings are being issued. Thank you.
Absolutely. Thank you, Claudia. To be clear, let me start with the last one with shelters. It's good to hear your voice. I hope you're doing all right. The shelters we have right now, I'll give you the stats, and then I'll go through what the strategy's always been. There's 4 shelters online. We have 140 people in them of 306 beds that are there. And we also have trailers, remember, right there, and there's 241 of those 270 trailers currently occupied. From the beginning of this crisis, we made it a priority to serve people that were unhoused. And we always saw that this was a temporary place while we would await more permanent and more secure places where it wasn't a mass congregate shelter to put people. Whether that's Bridge Home that's better built for those, and we've opened up in the same time more beds there that can be used than we had at the initial shelters, combined with, of course, Project Room Key to put people in hotel and motel rooms. We have not kicked anybody out of any shelter, so we don't shut them down and say you're out. It's as people have left. And by the way, when they leave, they're not just hitting the streets. I know you've asked, I think, in the past. I'm trying to get overall numbers. The last time I heard was a couple weekends ago, 25 people left one shelter because they just decided that was what they want to do. 17 of them, which is a much higher batting average for anybody who's ever worked in homelessness services than you usually get, went into another housing solution. Reunification with a family, a hotel motel room, a Bridge Home shelter, or permanent housing. We sprang into action very early to help many of our unsheltered neighbors and get as many doors as we could by opening up rec centers as temporary centers. We brought the trailers in, and we immediately started Project Room Key. So just to put it in perspective, the last hotel that we secured was more than all the remaining beds that are occupied right now, almost twofold. So as we continue navigating, we want more permanent solutions. We'll also be looking at those rec centers to help, for instance, in this school situation, some of our most vulnerable children to have daycare there as well, but that's not, again, why we're shutting it down, but that's one of the reasons. We always said those would be temporary, and we've exceeded the number of beds by far with the exits that are there than we had stood up at the beginning. So there are 3,774 Project Room Key rooms occupied, which is 90% of the total available. To give you an idea, in those rec centers that I mentioned, only 50% of those beds are occupied. So people are choosing, people are increasingly going to those other places as well. And we've also just administered under 10,000 COVID-19 tests on Skid Row. And I'll remind folks, we've been really glad to see, and knock on wood always, that our fatality rate, our mortality rates and our positivity rates are lower among people who are experiencing homelessness than those who are housed in Los Angeles, something I think we should be very proud of, and I'm appreciative to all the workers out there serving people who are experiencing homelessness and testing them. In terms of LA Unified, yes, I just actually spoke to the superintendent today. We've offered help in any way. We're not going to be directly administering those tests, but we also, as I've talked about here, have that medical group that we brought together to look at paper strip testing, and we're going to be looking at piloting that hopefully sometime September or October, early October, maybe mid-September. That, I think, will be part of the solution because we know those PCR tests that are part of the initial plan for the district are just quite frankly very expensive. But we do see some really good work that is already being planned, especially around research from the school district. So we're here to help, but we're not going to be directly administering those tests. But I reached out to say whatever help you need and vice versa. He's asked for some help, so we're going to follow up this coming week with our teams together, and hopefully we'll announce more when we have that. Anything else? Got it? Okay. Thanks, Claudia. Next question, please.
Thank you. That comes from Joel Pollack from Breitbart. Please go ahead.
Hey, Joel.
Hi, Mr. Mayor. You've talked about the issues facing small business and restaurants, as well as some of the really extraordinary things they're doing to help out. I'm just curious, in your presentation at the Democratic National Convention, you didn't mention the Paycheck Protection Program, PPP, which the Trump administration has championed and was supported by both parties when it went through the legislature. I'm just wondering if there was a reason you haven't mentioned the PPP either today or you didn't in the presentation either.
No, you know, and I'll be honest with you, I think you can ask your average business out there. First of all, I'll say the good and the bad. The good was that PPP got out more quickly than I would have thought. and it helped a lot of businesses, but it disproportionately also helped those businesses that already had good access to banks, who were with the big banks, who were the bigger customers, and the bigger businesses. Ask a mom and pop out there were two problems. For restaurants, for instance, it was a pretty abject failure because it required that you keep certain people employed, which was a tough thing for them to do in the short term. And so restaurateurs, don't take my word for it, who applied for it, most of them didn't get it, and those that did, it wasn't designed to help certain types of businesses. So the bad was that it really didn't hit the main street businesses that are the mom and pop small businesses on the backbones of our neighborhoods, which is why I'm so passionate in the second round that we do need another CARES Act. Call it the HEROES Act, call it the HEAL Act, call it whatever you want, I don't care, but get it done. And we have senators literally on vacation, a president on the golf course, when we should be taking care of Americans. With the unemployment insurance that got wound down, 30% pay cut, I didn't see a senator get a pay cut, but Americans that were depending on that have, essentially. And for our small businesses. The CARES Act money, also good news, something that came bipartisan. This isn't a partisan point. We are glad to have that direct allocation. We've already put $13 million of that directly in grants, which was much better than loans, by the way. So CARES Act money was more flexible also than PPE stuff that was maybe forgivable loans, but again, those rules were really tough for small businesses, and too many of them didn't have access to the sort of banks and the relationships to get it done. So you survey out there, and there's been plenty of these. Most businesses were not helped. The PPP recipients were, and that's good, but we got to do much better, and we've got to do much more. That restaurant that I mentioned tonight, All Day Baby, that, and the second restaurant that Lienta had, who was the co-partner of that, they are 95 of their 100 employees down. They have 5 left. So I think that says it all. Thanks, Joel. Next question.
We have no one else in queue.
Okay. All right, as always, I'm going to speak in Spanish as well. Thank you all. Be strong, be safe, be smart, stay home. We'll see you next week. Muy buenas tardes, Los Ángeles. Nuestra prioridad siempre es mantenerlos seguros. Esta semana hemos enfrentado a la ola de calor peligrosa y los incendios amenazando otras comunidades en el estado mientras seguimos el trabajo para luchar contra el COVID-19. Y nuestra ciudad está tomando acción. Restauramos energía rápidamente en áreas donde lo perdieron. Ofrecimos alivio para personas en nuestros centros de enfriamiento. Y nuestros bomberos se arriesgan para proteger la vida y la propiedad en nuestra región. Y gracias a ellos. Quisiera agradecerle a todos nuestros funcionarios municipales quienes están trabajando para brindar estos servicios y apoyo para angelinos. Y también les agradezco a todos quienes están haciendo sacrificios para luchar contra el COVID-19. Sus esfuerzos están dando fruto. El condado ahora estima que la tasa de infección está al 0.92. Todavía está bajo 1, que es crítico para disminuir la propagación del virus. Mientras nuestro nivel de amenaza de COVID-19 todavía está en anaranjado, esto significa que si seguimos en este camino, podemos tomar control de este virus. Recuerden que para avanzar a la próxima fase para abrir nuestra economía, debemos tener menos de 100 casos por cada 100,000 personas durante 14 días consecutivos. Y debemos lograr 200 casos por cada 100,000 personas para poder reabrir nuestras escuelas de manera segura. Estamos saliendo adelante. Hoy 5 de nuestros indicadores centrales están avanzando en la dirección correcta, pero todavía nos falta. Ahora estamos entre 280 y 320 casos por cada 100,000 personas. Y hoy les comparto que nuestras hospitalizaciones están al nivel más bajo que hemos tenido desde el 7 de abril, un gran logro. Y a través del condado hay 695 camas disponibles, incluyendo 560 camas de cuidados agudos y 135 camas en unidades de cuidado intensivo. Y también un inventario de 1,108 ventiladores. Y tenemos 420 pacientes que están seriamente enfermos, y este es muy triste. Nuestros pensamientos están con las familias, pero es una gran reducción del mes pasado. A causa de sus acciones hemos avanzado, pero no podemos parar nuestros esfuerzos. El virus sigue presente y la época de la gripe está a punto de empezar. Por eso, les recomiendo que piensen en cómo pueden recibir sus vacunas contra la gripe. Es muy importante. Hoy el condado nos informó de 1,759 nuevas infecciones, llegando a un total de 229,054. Y 693 de estos casos están en la ciudad de Los Ángeles, llegando a un total de 92,871 casos en la ciudad de Los Ángeles. Hemos visto personas quienes tienen síntomas que no se desaparecen y que pueden ser devastadoras durante semanas y meses después de que no son contagiosos. Este virus es terrible. Y aun si eres joven y con buena salud, si no lo mata, puede cambiar su vida para siempre. El condado también reportó 46 fallecidos, llegando a un total de 5,491. 2,414 de ellos están en la ciudad de Los Ángeles. Este virus es una amenaza a todas nuestras familias. Continúa su trabajo contra este virus. Y mientras estos números nos dan esperanza, sigue la realidad que el riesgo de COVID todavía está presente en nuestra región y tenemos que mantener nuestros esfuerzos para detener la propagación. Mantenga las precauciones y hágase una prueba de detección si piensa que ha sido expuesto al virus. En nuestros sitios de prueba esta semana tenemos la capacidad de hacerle la prueba a más de 18,000 personas cada día. Y el condado, más de 2 millones de personas se han hecho la prueba y la tasa de resultados positivos es 9,8%. En nuestros sitios de la ciudad de Los Ángeles le hemos hecho la prueba a más de 1,16 millones de personas y la tasa cumulativa de personas positivas es solamente 7,2%, menos de 10,7% la semana pasada. Estas son buenas noticias. Estoy agradecido al Consulado de México y al Consulado de Israel, quienes se han unido con el condado y con organizaciones locales para ofrecer pruebas al público en MacArthur Park y Boyle Heights también. Y seguimos desplegando equipos móviles a comunidades por toda la ciudad donde hay una necesidad inmediata para pruebas de detección para asegurar que todos puedan recibir una. Hoy tenemos equipos en el parque de North Hills y las viviendas en el Mar Vista Gardens y estarán en la Plaza Mariachi y el parque Green Meadows el sábado. Antes me equivoqué que no el domingo, sino el sábado. Perdone, antes me equivoqué que no el domingo, sino el sábado. Las pruebas son gratis para todos con síntomas o sin síntomas, pero priorizamos a la gente que tienen síntomas o que creen que han sido expuestos o son trabajadores esenciales o trabajan en sitios de alto riesgo. Visita nuestro sitio web para encontrar un sitio y hacerse la prueba, coronavirus.lcity.org/testing, o puede llamar 311. Y recuerde que si nuestro equipo de rastreo de contactos del condado lo llama, por favor responde a la llamada. Y le darán una tarjeta de regalo de $20 por completar la entrevista. Hablar con uno de nuestros rastreadores de contactos puede salvar vidas. Es crítico. Estas son las herramientas que necesitamos para poder abrir nuestras escuelas de nuevo. Además, como lo he dicho desde el principio, si está considerando organizar una fiesta o reunión, por favor, cancele estos planes. Estas fiestas pueden resultar en infecciones de muchos más y por eso no pueden tener fiestas. Esta semana, después de varios esfuerzos para las fiestas en una casa en Hollywood Hills, tuvimos que cortar la luz para esos residentes. Les recuerdo que todos tenemos el poder para salvar vidas. Proteger el público del virus también depende de poder mantener a todos en sus casas. Por eso fuimos la primera ciudad para implementar una moratoria en desalojos para inquilinos y residenciales y comerciales. Y congelamos la renta para cientos de miles de hogares y lanzamos el programa de asistencia de renta más grande en el país, más de $100 millones. Todas estas protecciones siguen en vigor. Al principio de la pandemia también anuncié un orden para proteger a nuestros trabajadores esenciales con el equipo protectivo que necesitan y garantizando el permiso retribuido por enfermedad para trabajadores y requiriendo medidas de precaución en el lugar de trabajo. Desde entonces hemos trabajado con líderes de industrias y empleados para asegurar que estén cumpliendo con esta orden. Y hemos tomado acción inmediata cuando encontramos negocios que no están cumpliendo. La semana pasada supimos que algunos negocios de camiones no están cumpliendo con los protocolos de salud. El director ejecutivo de nuestro puerto, Gene Soroka, se puso en contacto con estas compañías para obligarlos a aplicar los protocolos necesarios. Le agradezco a nuestros camioneros y a los trabajadores del puerto y otros trabajadores quienes mantienen nuestra economía en operación, especialmente durante esta crisis. Y gracias al liderazgo de Federación Laboral del Condado en luchar por la seguridad de nuestros esfuerzos, especialmente su líder, mi hermano también, que es el líder. Espero que este mensaje sea muy claro. Si está haciendo negocios en Los Ángeles, deben proteger sus empleados del COVID-19. Punto. Nuestro programa Al Fresco se lanzó en mayo para ayudar a nuestros restaurantes y pequeños negocios con permisos para comedores al aire libre en aceras y estacionamientos. Desde que lanzamos, 1,486 negocios han recibido sus permisos temporales para ampliar sus operaciones al aire libre. Estoy comprometido de asegurar de que los negocios que necesitan apoyo sigan siendo líderes en su comunidad mientras se recuperan de esta crisis. Esta noche estoy anunciando que estamos extendiendo los permisos para nuestro programa LA Al Fresco, que da la oportunidad de usar los aceros, propiedad privada y estacionamientos para terminar el fin del año. La extensión de LA Al Fresco pone primero la salud y la seguridad de los empleados, clientes y los negocios. Deben seguir las guías del condado, estado y ciudad. Los negocios con permisos de LA Al Fresco pueden descargar sus nuevos permisos en línea empezando esta noche. Por favor, asegúrese de imprimir y exhibir sus nuevos permisos. Si su negocio no ha aplicado, puede aplicar en línea en el sitio coronavirus.lacity.org/LA Al Fresco. Quédense protegidos, quédense en buena salud y, cuando puedan, quédense en casa. Fuerza y amor. Ten un buen fin de semana. Gracias.